Good afternoon, everyone. I'm Mark Mazur, the Robert C. Posen Director of the Urban Brookings Tax Policy Center, and it's my great pleasure to welcome you here today to this year's State of the States event. Obviously, this is an event being held virtually and not in person due to the ongoing COVID-19 pandemic, and that's part of the conversation today is to discuss how states are dealing with pandemic-driven budgeting decisions. The State and Local Finance Initiative, part of the Tax Policy Center, presents this event annually. It seeks to highlight important state fiscal policy issues. This year's event will kick off with my colleague Tracy Gordon, who will provide an overview of the situations facing states as many of them enter their 2021 fiscal year. This is a fast-changing environment, and I'm sure Tracy will do a great job setting the stage for our stellar panel who will discuss the various steps that state governments are taking to deal with this unprecedented economic situation, and also to discuss the challenges that the situation presents states going forward. Before we get to the substance of today's event, I'd like to cover a few housekeeping issues. Today's session is being recorded, and the recording will be posted online in the near future. All the slides that are being used on the event today are available at the website urban.org under events. All of our viewers today will be muted, so questions will need to be written. And I encourage viewers to type their questions and comments into the Q&A box at any time. Please include your name, your affiliation, much like you would do if you were at an event in person, so we know who's asking the questions. We'll be monitoring questions during the presentation and discussion. We'll try to get to as many questions as possible. To help us in that regard, it would be great if you all can write things that are in the form of a question and brief. I encourage all viewers and participants to engage in social media using the hashtag #LiveAtUrban. One thing I wanted to note is we're thinking about a follow-on event that focuses on local issues and local fiscal policy. So if you have thoughts for specific topics that you'd like to see covered in that sort of an event, or if you have suggestions for participants who would be great to have as discussants or panelists, please let us know. There are various ways to get in touch with us, but one of the simplest is just to email us at info@taxpolicycenter.org. And now, it's my role to introduce Tracy Gordon, a senior fellow at the Tax Policy Center. She'll provide background information so we can have a productive conversation about state fiscal policy landscape and the options going forward. So I'll turn this now over to Tracy.
Thank you, Mark. Thank you everyone for being here today. It's a pleasure to be speaking with you about this important topic. And as Mark said, my role is really to set the stage and let you know what's going on at the state and local level with budgeting and fiscal decisions. So let's make sure I can do this. Uh-oh. Okay, thank you. Okay, thank you so much. All right, so I'll be talking about how COVID-19 is affecting state and local government budgets. So July 1st marked the start of a new fiscal year in 46 states. So far, 42 states have enacted fiscal 2021 budgets, including 17 states that are on a biennial process. So they already had plans enacted, but some states are already revising those plans this year. New Jersey has actually been in the news a lot for extending its fiscal year through September 30th of this year, rather than starting on July 1st as it normally does. But actually a lot of states have enacted temporary budgets because of the uncertainty around this pandemic. So Massachusetts has a 1-month budget for July, and it will revisit that on a monthly basis. Pennsylvania's budget funds all agencies except schools only through December, whereas schools are funded through June 30th of next year. Rhode Island has authorized monthly spending at prior fiscal year levels. South Carolina also has a continuing resolution in place. Vermont has a 3-month spending plan and has indicated that they expect legislators to revise that in August. And I should say that one huge source of uncertainty here is legislative calendars. Many legislatures are adjourned as they normally would be, or have suspended operations or postponed operations because of the virus, because of concerns about exposure of legislators themselves. So These are very unusual, very uncertain times. Other states have passed placeholder budgets with, frankly, very optimistic revenue assumptions and assumptions about forthcoming federal aid. So I'm thinking of California, for example, and California has basically indicated if more federal aid is not forthcoming, they'll have to revisit their budget soon. So it's important to remember that states had entered this year with their highest fiscal balances on record, about 7.8% of general fund spending. So they were prepared, they had learned lessons from the prior recession. Obviously, there was a lot of variation around that average. So you've got Wyoming, which actually had more than 100% of its general fund expenditures saved for a rainy day. Illinois was more toward the bottom of that distribution. But in general, states were very well prepared. It's just that nothing really could have prepared them for something like this. States had projected revenue growth that was pretty solid on the order of 2.5% to 4%, but now all are facing revenue shortfalls because of COVID-19. These are data collected by my colleague Lucy DeDiane that show that of the 27 states for which we have data, they're projecting combined shortfalls of $34 billion in the current fiscal year. So what was the current fiscal year, fiscal 2020, and $80 billion in fiscal 21. If we extrapolate from those states to all 50 states, we're looking at a combined revenue shortfall of $200 billion. If you look at individual states, there's obviously, again, variation around that average. So tourism-dependent states like Hawaii are very hard hit with an 18% shortfall. Other states are at the low end of the distribution, but the average is about 10%. And again, this is based on their own data that they've reported so far. As you'll see, some forecasts are considerably worse. Also, I think it's important to remember that it's not just tourism and in this case, energy-dependent states, which was something that preceded COVID, the supply glut and falling oil prices. But also, the GDP report that came out yesterday indicated that finance, insurance, healthcare are all being affected by this crisis. So some of the decline in personal income taxes is just a temporary phenomenon that's driven by the extension of filing deadlines from April to July. So states could see some of this money coming back. This is just one example from California that shows that the governor was anticipating $18 billion in personal income taxes in April, and the state collected about $5. So that obviously creates cash flow problems. Longer term, obviously we are officially in a recession right now. This is a tracker that we have on the Urban Institute website that looks at initial claims for unemployment insurance. We're already at 44 million initial claims. We surpassed the level reached in the Great Recession after several months, after more than a couple of years, after only 12 weeks in this recession. So beyond personal income taxes, sales taxes obviously are seeing a big hit as well, and that's driven by declining consumption. So although there's been there were some initial increases in things like groceries, consumption for durable goods, for big ticket items that make a big difference for states' bottom lines, as well as for services, is about 10% below where it was before the start of the crisis. And then states are in this interesting position because of what someone once characterized to me as a 1-2 punch. That basically in a recession, their revenues are going down just as demand for the programs that they run is going up. So about 2/3 of state and local spending is on education, healthcare, social services. Demands for all those programs go up in a downturn. My colleagues at the Urban Institute calculate that because people are losing their employer-sponsored insurance, because they're losing their jobs, that they'll be in some cases going to Medicaid, in some cases to private exchanges. So there's a tremendous amount of uncertainty around these estimates, but anywhere between 8 and 26 million more people will be on the Medicaid rolls. And because of federal actions taken so far, which I'll talk about in a minute, states can't change their eligibility criteria. So there'll be many more demands on the Medicaid program. States already are seeing demands for unemployment insurance, which is a joint federal state program. Although states accumulate trust funds in good times to pay those benefits, those trust funds are largely depleted at this point. States already have requested to borrow $17 billion from the federal government, and we expect to see more. I mentioned states' own forecasts of revenue shortfalls, but if we look at historical relationships between unemployment or GDP on the one hand and state revenues and spending on the other, then the estimates actually get considerably larger. So Matt Fiedler, Jason Furman, and Wilson Powell have an estimate that for every 1 percentage point increase in unemployment, you see a $45 billion state budget gap. Based on this sort of rule of thumb, the Center for Budget and Policy Priorities looks at CBO forecasts, and they look at the May 2020 forecast, which is slightly different from the very latest forecast that came out last week, which still shows elevated unemployment through the end of, actually through the end of the decade. But combining that rule of thumb and CBO numbers on unemployment, they come up with a cumulative state-only budget shortfall of $615 billion. Doing a very similar analysis, Tim Bartek at the Upjohn Institute comes up with a relationship that suggests 1 percentage point increase in unemployment leads to a $22 billion local budget shortfall. And then some researchers at the National League of Cities basically extend that relationship and calculate a $360 billion 3-year gap for cities and towns. So we get in the $1 trillion range talking about combined shortfalls for state and local governments. Moody's estimates are lower in the $500 billion range, but they do have a scenario that accounts for a more severe recession and a second wave of infections, and that gets up to $750 billion. So there are many, many sources of uncertainty in these estimates. Obviously, the path of the virus, the severity and duration of the pandemic, federal policy responses, state and local policy responses, behavioral actions taken in response to those policies, the exposures of various industries and sectors of the economy, the exposures of various revenue sources, the effectiveness of policies undertaken so far, both by Congress and the Federal Reserve, and then future federal actions, including more aid for state and local governments. So federal actions undertaken so far, I don't want to minimize this. The federal government enacted about $2.5 trillion of relief in 3 weeks in March, and this really helped a lot for the state and local sector beyond the economy at large. So first, there was the Supplemental Appropriations Act, which was about $8 billion that had set aside about $1 billion for state and local governments, but mainly to deal with the public health expenses associated with the COVID crisis. Next was the Families First Relief Act, which appropriated about $105 billion, including about $40 billion to state and local governments through an increase in the rate at which the federal government matches state expenditures for Medicaid. And that's something that the federal government has done in prior recessions as well as natural disasters. The CARES Act appropriated $2.3 trillion with about $200 billion for state and local governments. The biggest ticket item in there was the Coronavirus Relief Fund, about $150 billion. Which had various strings attached, which we'll talk about in a second. There were also grants for education, about $30 billion, of which about half went to K-12 education and half to higher education. Grants for transit agencies, about $25 billion. Community development block grants, about $5 billion. So there was a fair amount in there. The CARES Act also set aside about $35 billion to seed a lending facility at the Federal Reserve for state and local governments. And this is available to all states and to certain cities and counties. So the thresholds have been changing to make it accessible to more and more local governments. So it's now counties above 500,000 population, cities above 250,000. And now governors, especially in small states that don't have a lot of cities and counties of that population size, can designate to local governments to be eligible for funds, as well as revenue-backed issuers, which is a big deal for transit agencies, higher education institutions, and other organizations that borrow using state and local tax-exempt bonding authority, but are no longer seeing revenues that they were expecting coming in to repay those bonds. So this is very helpful, as I said, but it's really not up to the magnitude or the timing of the challenge. Families First, the FMAP boost that I discussed, is tied to the declaration of a public health emergency by the Secretary of Health and Human Services. So it's anyone's guess how long the public health emergency will last, but state and local fiscal emergencies are not necessarily tied to that calendar at all. It really has much more to do with the state of the economy. And even then there's a lag. So people who are having less income now will be paying less in taxes next year. So states can expect revenue declines going into fiscal 21 and fiscal 22 at best. The CARES Act included this coronavirus relief fund, but that was explicitly not for revenue shortfalls and for expenses that were incurred to fight COVID. Treasury has released some guidelines that actually take a pretty expansive view of what that means. That includes things like remote learning or greater public safety expenditures for things like disinfecting public spaces. But those expenses have to be incurred by December. And again, it's not clear that it's up to the magnitude of the added costs that state and local governments are facing. The municipal lending facility, as I mentioned, is available to all states, but really only about 250 local governments and a selection of revenue-backed issuers. Also, these are loans, not grants, and they're very generous loans in the sense that they can be repaid over 3 years. But really, the Fed is buying something known as revenue anticipation note, which is a type of borrowing that states do when they're expecting revenues in April and they have bills that are due before then. Those kinds of issuances are very common. It's not really the kind of borrowing that state and local governments are used to doing to cover their operating expenses on an ongoing basis. So the other pending federal legislation, the HEROES Act, would appropriate about $1 trillion for state and local governments, including $500 billion in flexible fiscal relief, $375 billion for localities in particular, who are not explicitly taken care of in some other legislation. The so-called SMART Act would direct $484 billion to states, but require them to allocate some of that funding to local governments. Senator Wyden and others have a proposal now, the Jobs for Economic Recovery Act, which would boost the FMAP according to a formula that's related to unemployment. And so this is sort of an automatic trigger that would not require Congress to take action, but would just sort of, look at what's going on in the economy and respond accordingly, which would make a lot of sense given various conditions varying so much in states and so much uncertainty about the path of this virus and how long this crisis will last. So much has been said already about state and local job cuts, but about 1.5 million jobs have been cut so far. I like this graph because it's indexed to the peak before the last recession. And so you can see that jobs have declined by about 10% in state education, local non-education. The only state and local sector that's not affected is state non-education, and that's because they never really got back to where they were before the last recession. So it remains to be seen what these job cuts are going to mean for the services that businesses and people have come to depend on. And also, there's a larger macroeconomic concern about state and local government revenue increases and tax cuts dragging down the larger economy. So on average, state and local governments contribute 0.3 percentage points to real annual GDP growth. In the first quarter of this year, they contributed basically zero. And obviously these data are already old, but the concern is that this will go negative and have repercussions for the larger economy, as well as for people, as I've said, who depend on these services. So that's all I've got for today. And I think my role now is to introduce my colleague, Donnie Charleston, who is the Director of State and Local Fiscal Policy Engagement. Take it away, Donnie.
Hello, thank you, Tracy, for that wonderful introduction and the explanation for where we are as a nation with respect to how our states are contending with this crisis. I am, as Tracy mentioned, the Director of State and Local Fiscal Engagement Policy here at the Urban Institute, working with my colleagues in the Tax Policy Center and the State and Local Finance Initiative to help us really better bridge the gap between the research we have here at the Urban Institute and the needs that state and local policymakers have. I'm joined today by my colleagues. They can go ahead and turn their cameras on. In alphabetical order, we have Ann Kaiser, who is an elected member of the Maryland Legislature. She's in her 5th term as a member of the House of Delegates, representing the 14th District in Montgomery County. She is chairman of the Powerful Ways and Means Committee, previously having served as majority leader in the Maryland General Assembly. She, in her role, heading up the Ways and Means Committee, she essentially has a pulse on the direction of, policies, all policies essentially in the state of Maryland, from education policy to tax policy and so forth. One noteworthy thing about Ann is prior to coming to her career in politics, she served as an economist and policy analyst at the Treasury Department. Next, we have Shelby Kearns, who is Executive Director of the National Association of State Budget Officers. Prior to coming to NASBO, she served as Deputy Director of the Idaho Department of Labor, and previously worked in the Idaho Division of Financial Management for a time. In addition to her roles in government, she worked early in her career as Executive Director of the Idaho Rural Partnership, Program Director of the Idaho Association of Realtors, and Assistant Executive Director of the Idaho Wool Growers Association. So she brings a lot of experience and provides some insight that we can definitely leverage regarding what it looks like on the ground for people who aren't working in government, who are working in the private sector as well. Last but not least, we have Donna Ginther, who is the Dean's Professor of Economics and the Director of the Institute of Policy and Social Research at the University of Kansas. and a research associate at the National Bureau of Economic Research. Prior to joining the University of Kansas faculty, she was a research economist and associate policy advisor in the regional working group of the research department of the Federal Reserve Bank of Atlanta. She's had several teaching appointments in her academic career, and she's a native of Wisconsin, and she currently works with the governor of Kansas in terms of helping them wrestle with the tax reform issues that they're trying to manage in the state of Kansas. So welcome to my colleagues. Some of them I've known for a while, others I'm just now meeting in the last week or so. We're going to dive right in and try to help you, our participants and attendees, help understand some of these issues that states are wrestling with in this monumental crisis that we're experiencing as a nation. I want to turn first to you, Shelby. And we know that states are, basically in the throes of trying to understand how they can massage their budgets and use the different mechanisms at their disposal to manage this crisis. We know that right now, states are projecting serious declines in their revenues, as Tracy highlighted. And we know that at least 7 states are projecting, double-digit declines just in this year. And so with that in mind, what are you seeing as some patterns that are emerging from the standpoint of how states are managing this crisis?
Thanks, Donnie. A lot of what we're seeing are states still planning. I think Tracy hit the nail on the head when she talked about the need for federal aid, and states are still waiting to see what will happen when Congress acts. That'll make a big difference to whatever plans they enact. For the current fiscal year that's just closing, we've seen a lot of states use more short-term measures. They've maybe pulled money from their rainy day funds. They've used furloughs, kept positions vacant, maybe made some smaller cuts of 1% to 2%, canceled pay increases, those sorts of things to try to close the gap in the current year. And then going into the next year, we're seeing a lot of program expansions being canceled, and a lot of planning for cuts these range from plans for 4% to cuts to 15% as states really try to get their arms around what the magnitude of the revenue loss will be, and also, like I said, what sort of federal aid that states might receive. Nobody wants to make a large cut you can't roll back and then be able to fill that with some federal aid.
So, Ann, I want to turn to you next. So Maryland, each state is unique in its own regard. And you guys have some very unique challenges you're wrestling with in terms of your structure, in terms of how your apparatus is structured there. So what have been some impactful, important tools that you guys had at your disposal that have helped you weather this crisis?
I'm not sure if I can say we've weathered it so far, but I'm sure that's like every other state. One of the things that we tried to do during our regular legislative session was to raise some revenues. And those efforts were vetoed by the governor, but these were things like tobacco tax and digital tax and other things that are not, not broad-based, not really going after the middle or the working class. So these are things that I think we'll come back with some veto overrides in our next legislative session. We ended our session on March 18th, about 3 weeks early, just a few days after Tom Hanks got sick and the whole nation realized that this was a serious pandemic. So at the end of our session, we provided some extra COVID funds to the governor. We provided some added authority of moving some money around and created some grant and loan programs for our Commerce Department. So we tried to do some things at the end of our session, but I don't think anyone knew how long this would be dragging on and how bad the losses would be. We've done very little right now with our rainy day fund, despite the fact that it's raining pretty hard out there. The other thing, as many other part-time sessions, we're just in for 3 months every year, annual budget, a budget every year, is that we have what's called a Board of Public Works with our governor, state comptroller, and state treasurer. And they're allowed to cut up to 25% of agency funds, all of them. So that's a mechanism that we've used in many years, and that's something that's already been done, a little over $400 million so far. But we're like everyone else. We're waiting for July 15th, see what the state tax dollars come in, and we're still waiting to see what we get from the federal government.
And so Donna, with Kansas is a bit different compared to Maryland from the standpoint of just how your economy is structured, the very rural nature of your economy. So, what have been some tools or maybe even some challenges that you guys have had to wrestle with, given how your economy is structured as this crisis has played out?
Well, so we've actually had a bit of good news. In April, the consensus revenue estimates were a combined $1.3 billion reduction over fiscal year 20 and fiscal year 21. As revenues have come in, we got more money than we expected, in part because Kansas taxes groceries at the full sales tax rate of 6.5%. And that's about 15% of our sales, our sales tax base. And so groceries and use taxes made revenue come in at a higher level than we expected in June. The governor, we do have a shortfall now for fiscal year 21 of about $704 million. And the governor has wide discretion in the allotment process. And she's announced cuts of about $375 million from the fiscal year 21 budget. And she's proposed an additional $63 million in cuts that require legislative action. I guess we're all kind of, based on these cuts, we're all kind of waiting and seeing what will happen in terms of federal support to help with the Kansas budget situation. One thing I will mention is that, Kansas did not cut taxes as was proposed during the legislative session. So because of this crisis, we kept our tax policy stable as we go forward to deal with this issue. And a final thing I would mention about Kansas is about 18% of our labor force is employed in the state and local government. So if we do not get some sort of federal support for the Kansas budget, the recession will be deepened because we'll have to cut those workers in the state and local sector.
And you guys are in particular, I guess it could be viewed as being in even worse shape because you guys only passed the ability to have a rainy day fund last year, and you didn't have time to really fill that in order to deal with this crisis. So I think that puts you guys in a much worse situation than many other states as well.
Well, we're in better shape than we were about 4 years ago. So it's all relative in Kansas.
Indeed it is. I want to go back to you, Ann, because one thing you guys did pass in your last session was you guys will have a constitutional amendment. You passed that and will be on the ballot in the fall. And so that would give the General Assembly the ability to move funds around in the state budget. Now, not having that ability during this past spring impede your coronavirus response? And should other states be looking to add that if they don't have it in place?
Thank you for that question, Donnie. I think we're unusual in Maryland with the governor's authority with the budget. I think we might be the only state left that doesn't allow the legislature to move funds or add new funds. This is based on 100 years ago where the legislature ran amok, and the solution then was to really curtail our powers. And now, after all this time, we're finally realizing we need to give the legislature that opportunity. We still would not be able to go above the governor's initial budget amount when doing that, but to be able to move funds and add funds and really prioritize based on the values of our legislature. We have split government right now with a Republican governor and nearly 2-to-1 House of Delegates and State Senate. So definitely there's some different priorities. So I think it'll make the negotiating a little more useful, but I can't really say that it would have changed what we did at the end of our session in regards to COVID. I think we tried to do as much as we could in that short 7 to 10 day window that we were aware of this problem to provide extra money for pandemic relief.
So Donna, you touched on this a bit. I want to turn up the tables a bit to talk a little bit about unemployment. You touched a bit on this from the standpoint of how, what I think you said 18% of your employment is in state and local government. And so we've seen, unprecedented levels of unemployment filings across the nation. And so Tracy had that great slide that we have on our website that tracks the trends in unemployment over time. And so given that, I guess the question I'm trying to wrestle with is the reality is that as we move forward, business is not going to go back to operations as normal. Restaurants aren't going to be fully staffed because of social distancing. Many organizations aren't going to be able to staff themselves up like they were in the past. And so from a standpoint of innovation, from a standpoint of strategies that states can adopt, what are some things that you guys see on the horizon? I guess I'll ask you first, Shelby, that states can adopt. So I know that we have in place work share programs, I think in 27 states, but it's very underutilized. Only 1% of, I think, less than 1% of people collecting unemployment across the country actually participate in a work share program, which is where an employer can reduce the hours of their workforce and draw upon unemployment to cover a number of hours that they reduced. But only 1% of workers were covered under that in mid-May. And so there are some things in place that states can take advantage of, but are there other strategies that states should be looking to or could be looking to really manage how we get people back to work?
Well, in Kansas, there's a double whammy. So Kansas is Wichita, Sedgwick County builds airplanes, and the demand for commercial aircraft has cratered. I just saw today that United Airlines is going to furlough 36,000 workers. That's not going to come back until we've got a vaccine for the coronavirus. People are not going to, be willingly traveling a lot on airplanes, given the possibility of getting the infection. And so, since March, 90,000 workers have filed initial unemployment claims in Sedgwick County, a county of 500,000. So that's nearly 20% of the people in that county. And those jobs aren't going to come back anytime soon because aviation is very cyclical and we're in a downturn. So, the state is going to have to think about how are we going to retrain and repurpose these workers and diversify our manufacturing sector in order to reemploy our workforce. We have highly skilled workers in the Sedgwick County area and in Johnson County, and we need to think about how to take this idle time that they have to give them the skills they need to diversify our manufacturing sector. We're fortunate in the sense that as a state, we're not really tourist dependent. People don't come to Kansas to view our lovely mountains like they do in Idaho. So that has allowed us to weather this crisis to some extent, but we need to think about what the future holds in terms of our whole economy and how to diversify it and make it more resilient. And that involves higher education, I think.
Mm-hmm. So Shelby, what are you seeing across the nation that states are, coming to you or possibly sharing with you some of their strategies that they're deploying to kind of deal with this, which is really the core of what we're trying to wrestle with as a nation, is this unemployment crisis?
I think that it's a really good point that there's a lot of changes in this and it's very different. So a lot of it has to do with people feeling safe and being safe and going back to work, which means a lot of our traditional programs to get people into jobs don't apply during this time. So I think that's been a little bit difficult, but even programs like changing work search requirements and things that you can do to make benefits more accessible to workers, help them weather the crisis and stay in the workforce so they're able to go back. But there's a lot of work to be done, I think, in every state, looking at what is going to be the long-term effects. What is, mentioning the aerospace industry is a really good example. How are these things going to come back? Is tourism going to come back slowly? Will it look the same? And it seems like there's more questions than answers right now, but all states are grappling with that. What will their economy look like? How will they get people to feel safe going back to work? And how will you, in a service-based industry, convince people it's safe to come back?
Mm-hmm. And so, Ann, your state, more so than many others, is reliant on commuters. People, commuting into DC or commuting from the surrounding counties into Baltimore, and so on and so forth. And so, as you think about, those commuting patterns and how dependent, your economy is on the surrounding counties, what are some strategies that you guys are employing, or do you feel like you guys are more insulated because of the capacity for people to work more from home than some other state?
Maryland's very reliant, as they say, on the feds, eds, and mids. And so we have so many federal government employees in our two nearby counties primarily, and others as well. And like every other state, a lot of county and municipal employees. So that usually, you know, the low elasticity. That usually means we fall less than everyone else, but then we don't rise as fast as everyone afterwards. The projections in Maryland are for the unemployment picture to still be lagging until about FY24 and really not to be back in place until a couple years after that. So, you know, I think like everyone else, we're still trying to figure out what the solutions are. We have a group called the Board of Revenue Estimates, and that director just leaving was trying to advise all of us on the value of government spending to help in these situations in terms of investing in infrastructure and investing in our people. So when it comes to school construction and transportation and other projects that help put people back to work. But, you know, I'll keep going back to the idea of what we need from the federal government, and that how they can help so many of the states with so many of our government employees and investments in general. And I think somebody asked the question about how much do we expect as a downturn? And for us, it's a little over 10% of our revenues for this upcoming year that we expect to be down.
And so staying on that, you know, theme of, you know, multi-state, you know, integration, you know, Maryland, Virginia, DC, to some extent Pennsylvania as well. You guys coordinated, you know, quite a bit with the state of Virginia and the district, you know, around the COVID response and when you were going to implement, you know, different phases of your approaches. As you look forward, how do you see that multi-state coordination, you know, playing? Do you see that as playing a significant role as we think about, you know, getting everything back up in order?
Donnie, that's a good question. I just have to admit, I'm not sure what the answer is in that regard in terms of how, if we continue to move forward with that cross-jurisdictional collaboration. I mean, as just about many of your participants know, those from the DC area, how interconnected we are in Maryland, Virginia, and DC in this DC metro region. And so I think there's a lot of value in it, but it's unclear how we will move forward in that regard.
Mm-hmm. And Donna, for you guys, I think most of the coordination is really happening at the city and county level, particularly with the Kansas City twin communities there. When you think about that cross-border collaboration dynamic, are there any particular tools that you think could be beneficial to cities or have been beneficial to those communities to help them, you know, weather the storm?
Well, you know, Kansas City Metro straddles both Kansas and Missouri. And there were discussions among the governors about coordinating policy as well. But the KC Metro, the 5-county area in Kansas and Missouri, has a Mid-America Regional Council, which convenes these organizations and really speaks to the metropolitan area as one entity. And there's so much travel and commuting into and out of the KC metro area that really, to have a health policy to address COVID, you kind of have to coordinate all together. And if you see in Kansas right now, we're having a spike in our COVID cases, and that's really focused on the metropolitan area. So it's really important that they coordinate on both the health and the economic response. So that has progressed along, and they've done a good job of communicating.
And so Shelby, I'll turn to you. Are you hearing anything regarding states and how they're thinking about, you know, collaborating or coordinating together?
I think states are doing a lot of collaborating right now in many different ways, you know, partly helping each other find solutions and sharing information. But I think when we're looking at helping with the public health crisis, a lot of folks are trying to work together. It's hard to come up with a regional approach that really can stick through some of the problems that can create.
And so as we think about that dynamic of coordination, I think the one key thing that pops out is that coordination between state policymakers and locals, between cities and state officials. And so I know that the only state that I'm aware of that has actually targeted a response to their municipalities, the state of Alaska. They actually have provided some funding for the cities that have been heavily impacted by the cruise industry decline. And so that fund money was, you know, provided for them a few months ago. But as you think about your own state, and it's because unique revenue sharing arrangement that you say has its own puzzle of how those revenue streams are integrated together. And so, and as you think about, you know, how Maryland's structure, how does that structure, I guess in thinking about that structure, what are some strategies that you guys are thinking about from a standpoint of how you're going to help your municipalities, recover?
Donnie, thank you for that question, and our trying to, looking at the revenue options of the things that we tried passing during session that would have helped us with some of our issues right now. I would say that in the last recession, we not only raised taxes, but we actually maintained education funding, but that was with everything else being cut. So I think this time we'll be looking at coming back to some of those revenues, and we are hearing from the locals about what they need. And we also know that we're also trying to even just help them on the ground with some of the federal grants that are out there and the money that they can possibly get from the federal government. So at this point, there are so many problems and so many holes to fill, but we're certainly trying to help our municipalities in this.
And Donis, I'll turn to you in that, regarding that same question. I mean, are there any specific needs or strategies that have been or could be very impactful for municipalities and counties as they think about how to, come out from under this crisis?
Well, in Kansas, the focus on sort of how the state is helping the counties and local governments is how they're allocating the CARES Act. So the governor created this Strengthening People and Revitalizing Kansas task force, the SPARK task force, which is trying to allocate that $1.25 billion that came from the federal government to respond to COVID-19. And so an initial approach was to look at counties that were really affected in terms of unemployment and counties that were really affected in terms of COVID and allocate the money in that way. So that's a first pass. This is a work in progress. And the problem is that even though the state got $1.25 billion, the strings attached to the CARES Act money make it very hard to spend it, and hard to spend it by December. So I'm hoping that any future legislation coming out of the federal government kind of loosens those requirements so that money could be allocated wisely, not only to address the immediate costs of COVID, but the long-term sort of infrastructure changes that need to be made to address, how the state adapts to having this virus and providing public goods. So you think about how are you going to provide K through 12 education in a state? How can you spend that money? And you have to, retool the schools. You may have to stagger the school days. So half the students come out part of the day and other half the students come other part of the day. That would increase bus routes. There are all of these niggling details, and trying to think through that process by December and spend all that money by December is a gargantuan task and will not lead to an effective allocation of resources. The state budgets are under stress and the local budgets are under stress, and they need to have the latitude to spend the money so that they can address the needs that are in their particular locality.
So next we can turn to this idea of, tax cuts and tax increases. And I'll turn to you first. And Maryland, as you mentioned earlier, passed a number of tax increases during your past session before the crisis really hit really hard. Digital advertising, digital downloads, vaping, and I think tobacco as well. And so during the 2008 recession, we saw a number of states passing tax increases along with, cuts to education and other core services. But you guys included an important provision to halt spending in the event of a crisis. And so that was something you guys put in, in the spring as you guys were your session was coming to a close. So tell us about how that trigger works. I mean, I don't think we talk enough about how triggers can be important budget mechanisms that can be used. So how does that work, and how do you think it's going to play out? Your microphone is muted.
Thank you, Donnie. Sorry about that. Yeah, the taxes that I mentioned that we already passed, and on our House side, we even tried a few other things with corporate tax loopholes, increased sales and use tax on certain services, and reforming some of our tax credits. So we tried a whole lot of things, including the measures you already mentioned that we passed on the House and Senate, but the governor vetoed. This past 3 years, we've been looking at redoing our K through 12 education program. And we were studying it for years, and we've had bills every year. And then finally our Commission on Innovation and Excellence, we passed a big education bill that's supposed to increase funding dramatically over the next 10 years. And that too was vetoed by the governor. But a few key things is, one, there was no reason to veto it because we actually have paid for the first few years already. And despite the fact that typical sales tax are down, our online sales tax helps fund this education blueprint, and those are up. Everyone's shopping on Amazon right now instead of going to the store. So we certainly had enough money there. Our state Senate wanted to put a trigger in that if we had lost about 7.5% of our general fund, about 1.5 billion, that if we had lost that much money, that there should be a trigger in there to stop this 10-year education plan at any given time. And I remember when we were discussing it, it was a good week before we decided to adjourn early, and there was kind of a laughter in the room that we'll never have a hit like that. We've never had a hit like that. That let's accept this trigger from the Senate because it won't really do anything. And of course, within the next few days, we realized it would have. And so that would have, even if the governor had it vetoed this big education blueprint plan, this trigger would have been in place.
And so, Shelby, as we think about other states across the country, there's, I think, roughly 20 some odd states that have enacted cuts by the legislature, or the governor has ordered across the board cuts for state agencies, or they've essentially held spending, flat, which is essentially, many are cut in and of itself. As you think about that landscape and you think about your own experience from Idaho, what are some strategies that, communities like Idaho and some of the rural states may be turning to if no relief comes from the federal government?
It's really tough because without relief from the federal government, states are going to have to make really drastic cuts. What we're seeing is projected revenue loss that really eclipses what we saw in the Great Recession. And I was in the budget office during the Great Recession, and that felt really painful. It was about 11.6% over 2 fiscal years is what states lost from their general fund. And that was really painful. And now we're looking at states in 1 year saying, 12, 20, in some cases, even over 20% revenue loss. So we know it's going to be really painful. And, we look back at the strategies that states employed during the Great Recession, and, in fiscal year 2010, half the states made across the board cuts, 35 made more targeted cuts, many cut aid to localities. The majority of states cut Medicaid provider payments. There were a lot of things that were done, and that's what we look back at, or kind of what are those strategies? That's the toolkit that states have. It really doesn't change very much. There's only so many tools in the toolbox, but they're not all great options during a public health crisis. We're looking at some of the things that we did in Idaho when we had to cut the budget. And I think about we tried to consolidate some of our operating costs in corrections. We got those down pretty low. Well, in this environment, you don't want to try to maximize your space quite in the same way. You can't really, you cut education, you're going to have fewer teachers, you're going to have a more crowded classroom. That's not a good idea during this time. Cutting Medicaid provider payments, those things might not be wise during a public health crisis. So a lot of the tools we have, honestly, just are really not good options without federal aid to fill some of those holes.
Mm-hmm. So there are roughly 5 states that have already voted to increase income taxes in some way, shape, form, or fashion. And California has limited business tax credits to $5 million to up for the next 2 to 3 years, I believe. And then I think they're estimating that could provide $2 billion in revenue for them. North Carolina and Colorado both have decoupled from CARES Act provisions by eliminating some of the deductions that were available to business under that CARES Act. So they found some revenue there. And then Arizona eliminated some tax cuts that would have exempted pensions from income tax. So a few states are actually going in and kind of tweaking their income tax structures to kind of find some revenue stream. So I wanted to ask you, Donna, as you think about, those types of cuts, and given Kansas and its history around tax cuts, what do you see as, the prospect for well, we already announced that there'll be some cuts coming down the pipeline in Kansas. So how do you think that's going to play out in the near future?
Well, we cut the budget in Kansas so much that there's not much left to cut, right? So Kansas is not going to be able to, slash the budget in the way that we did 2012, 2013, because we've already made severe and significant cuts. It was a victory that Kansas did not try to cut taxes in the last legislative session. There is an eye on closing the loophole for marketplace facilitators to increase use taxes. Also, we're discussing taxing digital goods such as Netflix and electronic books and things of that nature. Kansas is okay for fiscal year 21, but because of our settlement for our K through 12 funding in fiscal year 22, we're going to be experiencing budget deficits. We were projected to experience budget deficits because of those K through 12 expenditures. So we're going to have to come up with more revenue. So there might be more sin taxes increased. There'll be a lot of discussions, but it really depends on that thing that's happening in November, the election, and what the makeup of the state legislature will be. And what how they will, no first term, a House representative or senator is going to want to vote for tax increases, but they're not going to really have a choice given the dire situation facing us with the budget.
I think you all have hit on this theme that, states are in desperate need of some action by the federal government. Barring that action, and this is kind of reflecting on some of the questions we're seeing in the Q&A, and we'll kind of turn to those questions here in a moment, so bear with us. And as you think about what are some out-of-the-box things that you guys are possibly considering adopting, assuming that the federal government doesn't come through in the way that you need them to? What are some out-of-the-box budget or tax mechanisms that you're actually thinking about?
Sure, out of the box per se. One of the you mentioned earlier, or had me talk about our one constitutional amendment on the ballot this fall for about budgeting power. The other constitutional amendment, the other referendum we'll have on the ballot is regarding sports betting. Though I think every state that has it and every state that's considering it knows that even if, in our case, if it passes on the ballot in November, we still have to pass the implementing legislation and it still has to build up. So we're certainly expecting some extra funds there, but that's, that's small state budgeting purposes, about 20 million a year, maybe 20 to 30 million. I think there'll be a heightened push for the reconsideration of marijuana legalization other states have experienced. So I do think, and potentially that's the out of the box that could potentially bring a couple $100 million. But I really think it's, back to some of these revenue issues and targeted cuts.
So Shelby, what are you hearing from other states regarding some things that they're considering that they maybe wouldn't have been considering years ago, considering, as you mentioned earlier, that many of the strategies that worked during the Great Recession really aren't available or won't work as well this time? So what are some out of the box things that you're hearing from other states?
A lot of those I think have been hit on, finding new sources of tax revenue. Those are difficult. They take time to pass and then also to implement and see revenue. And quite honestly, they're not going to fill the holes. But those are some of the more out of the box things that I think people or states are willing to look at things that were maybe unpalatable before.
So I want to actually bring in Tracy Gordon back to the conversation. She's available there. We've had a number of questions. This was prior to so when people were registering for the event, there were a number of questions posted. A number of them focus on this question around deficit spending and borrowing. And I know that Fitch, I think, posted a few weeks ago that New York, New Jersey, and Illinois have actually are actually moving forward, with this question of borrowing to kind of deal with this crisis. So what are your thoughts around that as a strategy and its availability to more than just those three states?
Yeah, I think that's such a great question because, as Shelby mentioned, the size of the hole is so large, and so it's clear that all solutions really need to be on the table. Certainly that municipal lending facility that the Fed has made available makes borrowing easier. And I think Illinois is one of the first states to access that facility. The rate that the Fed is charging is supposed to be a penalty rate, although I think it is still on the lower side. You know, the issue with any kind of borrowing is it needs to be repaid. I think there are probably better and worse ways to do it. I lived in California during the early 2000s recession when the state issued economic recovery bonds, and they sort of famously passed those bonds, so they had to seek voter approval, and that would probably happen in states that that followed a similar path. And then they adopted certain institutions that basically said, and we'll never do this again. And some of the commercials that would actually show people kind of ripping up the credit card. So if California wanted to borrow, for example, it would have to undo those institutions. But I do think that that provides sort of a path going forward. And that might also be something that is a condition of federal aid that, I mean, at least there is talk about sort of requiring certain reforms at the state level. The question is really, you know, is this the time to sort of use the leverage that the federal government obviously has over states to enact things that might be a good idea? You know, by all means, we should have, you know, a look at structural imbalances, but you know, when there's a fire, I think you want to put the fire out and not necessarily, you know, start addressing other longstanding concerns with state budgeting. So I think we will see borrowing. It's going to be tricky to figure out how to structure that. It will probably require going over certain hurdles, but I don't think that borrowing alone by any means can solve this problem.
And so either one of you, so Donna, Ann, or Shelby, either one of you want to weigh in. I guess I'll go to you, Ann, first. What is your, as you think about this question of borrowing, what is the prospect of Maryland, you know, availing itself of that strategy?
I think it's not likely that Maryland would take advantage of that type of short-term borrowing from the feds. The challenge, we don't really have a liquidity issue. We have a lot of different funds that we could get to, you know, it's a borrowing tool of last resort to rob from our funds and transfer that money to our general fund. But that's something we did in the last recession and something we're more likely to do. The challenges that we have in Maryland is more so after we get the federal support like we did in the last recession, that it's that our growth afterwards is slower than everyone else's. And that's when, you know, we have some more challenges. But I don't suspect that Maryland will be relying on that.
Shelby, do you have anything you want to add to that?
I think that's the case in many, well, actually most states, that they're not going to be able to borrow their way out of this crisis. And, you know, eventually they have to be able to pay that money back. So unless it's actually a liquidity issue at the time, which most states, that's not their issue. They can get their hands on the cash. That the issue is the revenue is not going to be there. So they're going to have to balance the budget, and you can't borrow your way out of that.
I think that's true in Kansas as well. We were really good at borrowing from our Department of Transportation budget to fund our state during the budget crisis. So we're good at budgeting that way.
Well, one of the problems I might add onto that is that a lot of states did do that during the Great Recession. They sort of rated anywhere where there was a cash balance, and those cash balances haven't built back up. So all those pots of money that, you know, those of us in the budget office looked around and targeted and rated to fill general fund holes don't exist anymore.
And the other thing in our case in Maryland is that like 10 other states, I believe, we have a AAA bond rating. So there's a concern that if we do that type of borrowing, that would hurt our bond rating. And as I understand it, we've always been AAA. So that's something that no governor wants to be responsible for.
Right. And I'm sorry to keep belaboring this point, but I do think, you know, another thing that bond rating agencies look at favorably is the ability to shift costs down to local governments. And that's something that was done in the last recession, and, you know, might be something that states have to do, but that would be difficult for local governments and for people and businesses that depend on those services.
So another question that's popped up in the Q&A is this question around Medicaid and how states can manage that. So Tracy mentioned in her opening, during times of crisis, we see an increase in the need for services. At the same time, there's pressure to cut those same services. So as we think about the ability of states to cut provider rates and other strategies, Shelby, what are your thoughts regarding some strategies the states could employ to kind of manage this need in the wake of decreased revenue to actually supply that need?
One thing that I think we'll see that's a little bit new are states reviewing their managed care rates because there's been lower utilization. As we all know, there weren't as many doctor's office visits and procedures during this time as where things were shut down. And so I think those managed care rates might be looked at, and that could create some savings that helps in the short term with increased utilization.
Ann or Donna, do you want to comment on the Medicaid question?
Well, it's certainly true that our enrollment has jumped, and I was looking at this and other entitlements that in the recession, things jumped like 10 to 30% over a year and a half, and in this case, more of a 30 to 50% jump in a couple months. So it's obviously been drastic, and I'm sure like every other state, but I think it's something that Shelby already said, the utilization is down, that there's decline in other categories, dental and other things that people can defer certain non-emergency care. So it hasn't been a big issue for us in Maryland. And also, given that we've expanded the expanded eligibility under the Affordable Care Act, we get about 90% back from the feds. So it hasn't been, the Medicaid issue has not been a problem yet for Maryland. It could be in the future, however.
And so we have a number of questions that are coming in, and we'll try to get to as many of these as we can. We have about 10 minutes left. Tracy, this is a very specific question. What roles do you see state sovereign wealth funds, i.e. Texas, New Mexico, Alaska, playing in budget stabilization? Your microphone, Tracy, your microphone. Tracy, turn on your microphone.
Sorry about that. Sorry, no, I was saying I saw that in the chat feature and I had to kind of jog my memory about state sovereign wealth funds, but they're rare, right? So not a lot of states have them. They're sort of a historical accident where states, have some kind of land or assets that they manage and then use the income from that to invest in, say, like education in Texas. And so, but I think, so I think as we said, like everything is on the table. Certainly if there are assets lying around, states are going to be trying to figure out, how to repurpose those. Famously in the last recession, Arizona sold its capital and then leased it back so that it could have some revenue, which, people sort of made fun of at the time, but you need to have revenue and it's worth, incurring those costs later. So, none of these things are great policy. It's sort of like, when the federal government is up against the debt limit and they undertake these extraordinary measures, there's just things you need to do in a cash crisis. But getting to sovereign wealth funds, I don't know enough about the institutions surrounding those funds, but one thing that we see with rainy day funds, for example, is that they can have pretty restrictive rules about how the money has to be, the rules regarding withdrawing the money and using the money and when it has to be repaid. And so it's interesting because, crises create opportunities, and it might be time to revisit some of those rules, not just for the sovereign wealth funds, but also for rainy day funds, where there's a large body of scholarship that we've contributed to, and some of our colleagues that we work with a lot, showing some of the deficiencies in those institutions that were set up, a century ago.
So we're going to move around a little bit, mix it up. I think would be irresponsible if we didn't address, one of the major crises that our nation is contending with, and that's this, push around to defund the police, to address issues of inequity that are present in many of our communities across the country. So I wanted to get your thoughts on that movement and how you may be addressing that or thinking about it, or conversations you're having with your colleagues as you're having Zoom conversations or whatever have you in your shelter at home movements situations right now. And I'll turn to you and first kind of see, what are your thoughts around how that could play out? Would you see the possibility of legislation being introduced in Maryland and what that could look like for you guys?
I definitely see that possibility of legislation. Thank you for that question, Donnie. The real key thing is, will it be driven by the leadership from our speaker and Senate president and be one of those priorities? I do know that dealing with police relations is right now one of our #1 priorities. Now, I do think that defunding the police is an unfortunate slogan for what we all need to be doing, which is rethinking our budgets in regard to public safety, and that when police are showing up on the scene, should should it be a social worker in some cases, or should they be with a social worker? Does there need to be more recreation funds in some of our neighborhoods? So I would say for now in Maryland, the discussion's a little premature. People are having the conversations one-on-one, but there haven't been large conversations within the legislature getting people together to discuss this. But I suspect there will be lots of measures in our next session that starts in January.
So Tracy, I know you guys wrote a blog on this topic, and so can you kind of touch on some of the complexities of this, issue as states try to, are undoubtedly going to be wrestling with it?
Yeah, I think Anne really hit the nail on the head, that it's not about just zeroing out one agency, but figuring out how and where to reallocate money for better outcomes. And I've long been a proponent of reforming budget processes so that we have better information on outcomes, so that we know in better times when we get an extra dollar in, where should we allocate that dollar? Where will we get the biggest bang for the buck? And so I think that's really the underlying question here. And it's an exciting, research opportunity to figure out those questions. I think there's sort of a narrative out there that there was an article written by, a friend and colleague of mine, that governors are going to be in the role of grim accountants, sort of presiding over this economic downturn and no longer enacting, bold policy initiatives they might have run on. And I think there's a problem with that narrative. I think you can lead in a crisis, and it also means you can re-examine old ways of doing things. And I think that, budget officers, sort of, know where the bodies are buried and know, where there's flexibility. We have a report on budget flexibility that where a lot of people that we interviewed at the state level made that point, that it's paradoxical that in a crisis is really where you can look at things like revising the way that you pay Medicaid providers, or things that are seen as sacrosanct. Some of those strategies, again, are sort of short-term to get you out of a crisis, not necessarily these long-term reforms. But I do think it's exciting to think about, sort of new pathways, new opening up, and new research opportunities into thinking about what is the best way to deploy public funds.
So I know we've seen New York, we've seen California, actually movement on this issue. So Shelby, are there any other states that you are aware of that are actually, taking action in this regard?
We haven't seen a lot of action yet. It's still new. Legislatures haven't convened, but I think Tracy really hit the nail on the head with that as well, that this is a time of innovation. When you're facing a budget crisis, a lot of times it's the best time to examine what you're doing. And while it's not about savings, it's about redeploying funds in other ways. I think we did see a lot of that come out of the Great Recession, and a willingness to examine policy points of view, particularly when they had a net zero budget impact, or a savings in one area. And this could be all coming together at a time that will allow states to really re-examine where they're, and localities. I mean, it's a lot of this is more on the local side than on the state side too.
And so,
some of the research that we've done about looking at the long-term effects of tax cuts, we found that states that cut taxes cut expenditures for mental health and increase the jail population. So if you think about it, as you cut the public expenditure, it creates unintended consequences. And so, the defund the police movement needs to be, framed as how you provide the public services to reduce police involvement and engagement. And that centers around mental health and other social safety net issues.
Mm-hmm. So I think what this raises for me is this question of, so we have the Great Recession, we have COVID, and now we have this conversation that's happening around, restructuring finances and moving money around. And it seems like there's, at least even if it's not a greater appetite, there's greater conversation around really talking about this structure of our budgets and where do we derive our revenue streams and so forth. And so as we think, forward to the next 5-10 years, what are your guys' thoughts around states really taking a hard look at how their revenues structures are put together from the standpoint of where we're deriving funds and so forth? So is there any prospect for seeing some movement around restructuring our revenue systems? And I'll turn to you, Ann, first for that question.
Certainly, and thank you for that question. In fact, I had legislation this past legislative session, as did a few of my colleagues, on having a tax commission. And ours, actually, we modeled ours much after what DC had already done, and we were trying to look at what could, what could broaden the base, what could relieve the working poor a little bit, what could better tap, corporate taxes, what the whole mix, and trying to get that done. There was a concern that to pass a tax commission, this was before the pandemic came on most of our horizons. But again, back to our split legislature, there was a sense that if we passed a tax commission, it would be sold by our governor as the Democratic legislature trying to find ways to tax more. So there was a sense that maybe we shouldn't pass a commission at this time. What's interesting, as I mentioned, that political calculus of not moving forward is we're one of the few states right now not having any legislative elections. We all have 4-year terms in our House and Senate. So we even took this political calculation several years prior to an election to not do this tax commission, but I suspect it's something we will pass probably in 2022. So in a few more years, we'll take another look at it.
And Donna, you guys are kind of involved in this already. From someone looking at your entire system of taxation and making some recommendations to the governor. So what does that look like? And does this new conversation, weigh in regarding the thoughts of the members of that commission?
Well, we're meeting next week to revisit how we're going to go forward. Our last meeting was at the end of February before we had the COVID crisis. And at that time, we were looking at having a way to sort of reallocate some of our excess revenues. And now the conversation is going to be very different. How can we increase revenues and make our tax system more fair? Because our tax system, because of our dependency on sales taxes, is rather regressive. So moving forward, we're going to be staring at the budget deficits caused by COVID and our court mandated payments to K through 12 education. And so we're going to have to come up with ways of increasing revenue, broadening our sales tax base, but perhaps, and finding new ways to balance the budget.
And Shelby, actually, well, leave the last point on this to you. Do you have any insights or any from other states from the standpoint of what their thoughts are regarding this topic?
It does look like states are starting to think about whether their revenue streams are the appropriate ones. And I think we're seeing that internet sales have gone up. So I think there's a little bit of talk about using those in new ways. And the states that have taxes on groceries, like we talked about, those states have fared better. So I think there's a lot of pieces and parts that states are looking at, not just to close the gap, but just knowing that this crisis is going to go on for a while, and also that it probably won't be the last crisis they face. So I think we are seeing states start to think long-term about their revenue streams.
Indeed, they will be, and I think that will be more incumbent upon us as people who are, in the I guess the chattering class or policy analysts to kind of help them wade through all of that. And in that vein, I want to kind of alert our audience. We're at time. I want to alert you to a series of events we're going to be doing. Focus on local issues, so focus on cities, focus on counties with the same type of dynamic. And in addition, for those of you who are interested, I think it's tomorrow, if I'm not mistaken, it's Thursday, we have a feature called The Prescription, where we feature thought leaders. And this week we're featuring Raphael Bostic. And so you can go to taxpolicycenter.org to sign up to hear his podcast. He'll be interviewed by one of our fellows, Howard Gluckman here at the Urban Institute. And so definitely tune into that and stay tuned for what we have coming down the pipeline in the coming weeks and months. And with that, I want to say thank you to all of my panelists, Shelby Kearns and Kaiser, Donna Ginther, and Tracy Gordon. It's been a pleasure. And thank you all, and be safe and be well.
Thank you.
Thank you.
Thank you. Thank you.
Take care, everyone.